Good morning all, this is Steph from Surgery App. Today is Wednesday 27th of July, and in this video we're going to go over with you all the latest updates in the latest app release. There's a lot to go through. This is quite a long video, so in the description, if you scroll down in the description, we've given time frames for this video, so you can click on the section relevant to you. Okay, so we're going to share full screen now so we can start the presentation. So you can see here that we're in our test surgery again, Grange Road surgery, and the GP and the cluster page is here for you. Again, this is a fully managed service. We've got some changes in the portal. So the portal does look a bit different now. It's arranged a little bit better for you with subtitles for everything you need. But as I said, this is a fully managed service. So if you want us to update the app for you, that's fine. Just email us or raise a support ticket and we will update the app on your behalf. So let's start the presentation. Okay, so the first thing, we're going to highlight everything now. So we can see now we've got a lot of buttons in the app and we've got all these buttons active so we can show them all to you. Now, obviously, not all of these will be relevant to you. So if you want to switch something off or not have it in the app, as before, anything that has a tick in it in the home screen links means it's visible for patients. So if you don't want to use anything, we can simply untick that for you, and that will take that button out of the app for you. But for the purpose of this video, we're going to cover absolutely everything today. So first is Newsflash. So if you want to give patients a Newsflash, you can just, we can, or you can add a news event very easily. Just go into the portal and click on News. Click on Add New, and then follow the instructions on the page. You can upload an image, you can put an expiry date to the news event, and if you click on News Flash, then that news flash will always appear in red at the top of the app for patients to see. And the patient can click on it, and this is quite pertinent now, isn't it? Take care in extreme heat, but they can click on that news event for you. Okay, so that's the news event. Right. Let's go back and click on eConsult. So a lot of practices are still using AccuRx, eConsult, Ask My GP, Clinic. We can link to any service provider. So let's go down to the home screen links. We can see here we've got online triage. Now we've got Ask My GP, eConsult, Engage Health Systems, AccuRx, Clinic, EMIS, and any other provider. Now you can choose now which logo you want. So at the moment we've got the main logo here, which is eConsult. You can change that to just a verbose link. So if I save that now and update the app, ignore the part on the right, this is our coding, then it just says I need help with a medical issue. If you wanted a bigger logo, verbose link, Triage provided logo link with verbose link text, we can have that option. And let's update the app. Then that will have it. That's how it will look. It has bigger writing and a bit smaller link logo. If you want the full logo, then we can put this in for you with logo with brief text. Save that. And then it goes back to the big logo. If you're with another provider, we just simply change the provider name, eConsult, to, for example, AccuRx, and click on Save. Obviously, we would update your link as well. And then, there you go. The link is there. And when patients click on this link, it will take them to your triage provider. So that's the update we put in. So some practice managers said that they wanted the AccuRx or eConsult or whichever triage provider you have, they wanted that link there so it's easy identifiable for patients. So we can make that available for you now. Now, if you're switching that off and you've stopped using eConsult, then all we need to do is take the tick out of online triage, save, and when we go back to the app now and refresh, then you can see that that link has been taken off. So for those practices who maybe don't use a triage provider, we've been asked by practices to build forms for patients to request non-urgent appointments. urgent, triage requests, treatment room appointments. So we've got in the app a custom form builder, which you can see under forms and workflow. Workflow we will cover a little bit later in the video. So we've got a custom form builder, and we can build forms for absolutely everything. You can see here we've got quite a few forms we built here. Nurse appointments, on the day appointment requests, contact us about a new or ongoing symptom. So we've sort of duplicated a lot of what eConsult, Ask My GP, AccuRx have got in their forms, like Flori forms or triage forms, and also what receptionists would usually use as a script when a patient phones in, to try and reduce those phone calls coming in, because we know now you do have targets to reduce inappropriate phone calls or ease the burden so patients you don't have that log jam at 8 a.m. in the morning. Well, now patients can simply choose to submit their clinical request, contact us about a new or an ongoing symptom in a form, and we can build this form for you. Again, everything will be bilingual, and we are working with Bangor University. So when you use Google Translate will translate word for word. So when it does translate into Welsh, it translates completely wrong, because sentences becoming incoherent. Bangor University and the United Technologies Unit and Welsh Government have produced an enhanced translator. We do have an API for this. So anything that needs translating, we can put into here, and it will translate it sentence or phrase by phrase, not word for word, so that the Welsh translation is coherent. Okay, so we've built this in. So anything so the API is being applied to the app. So anything that you build in English will automatically be translated into Welsh for you by us also. And when we build forms, if you want a success message, so when patients submit the form, you can put anything in there to say, please ensure you always have access to a telephone. You can say, please note non-urgent request may take up to 5 days. Whatever message you want, success message, you can put in there. And also now, if the form, we can build any kind of form for you with single text line, multi-text line, if you want patients to give more of a detailed answer, an email, date checkbox, just a yes or no answer if you need that from them. Drop-down menus, they can choose from those. Radio buttons, which means only one option can be selected, or checklist, which means multiple options can be selected. They can upload a file such as a photograph. They can easily submit a photograph into now. And if a form needs a signature, like a request to access medical records or change of name and address, they can digitally sign the form now, so that signature comes in. And we've applied that also to the GMS1 form for new patient registrations. Okay, so we can build any type of form. So for example, let's take a look at this now back in the app for surgeries who may not be using an online triage provider, but you still want to give the patients the ability to request an appointment of any type through a form. So let's take a look at this request for an appointment. It has instructions here. You can put whatever instructions you want. Please complete the form below, check it's not an emergency, call 999, and you can put all the criteria here. So medical issues, please describe the medical problem. If you're filling this on behalf of someone else, please make that clear. They can put the symptom in here. Again, if they need to attach a photo, which is optional, they don't need to fill this. And again, when we build forms for you, we can make fields mandatory or not mandatory. We can work with you to decide what's mandatory or not. How long have they had the symptoms? Is there anything else particularly worried about? How would you like us to help? Please enter the times during the surgery that we cannot contact you. Is this form for myself or somebody else? They can put their patient details in. First names, last name, date of birth, postcode, phone number, mobile is preferred. And how would you prefer for us to be reviewed? Telephone, video, email. You can put in there if you wanted to. Or you can put in face to face. So if I save that very quickly and update the app again, then you can see that field has now been added. So face-to-face is now there. So we can build the form around your requirements. Now these have been built, these questions have been taken from what eConsult or AccuRx or Ask My GP have in their forms. Not exactly, but something similar. Now we can build the form to your requirements. So these questions may not suit everybody. you may want to follow a triage form that you already have built in the surgery. We can work with you, or you can send that to us and we will duplicate that form in here for you. But this will help patients to, or will help practices to reduce that 8 a.m. logjam, which I believe you're now being asked to do in the new access guidelines, and give patients the freedom then to submit requests for appointments, urgent, non-urgent, triage, whatever it may be, through the app digitally. And these will also be duplicated in our new website offering we have coming out for you. Any forms you have built in the app will automatically then be duplicated in the website as well. Right, okay, so next we go on to admin queries. So admin queries, it's very important that we cover this for patients, because around 40% of calls coming into you guys relate to admin requests. And one more point, going back to request for appointments. Now, if you've got to a safe level for the day and you want to switch this off, then if we go into the portal and go back here, then we can do that for you. If you say, okay, well, we've got enough appointments for the day, instead of going to a form for request an appointment, you can go to an information page, and we can then build a page for you. And on the day, appointment requests are now closed. So you can switch off the appointment request when you get to a certain number. We have been asked by practice managers to put a timestamp on this. So for example, if you only want to make them available between 8 a.m. and 12 p.m. every day, the next app update will have a timestamp here where you can specify where that form is automatically switched off. I believe that's going to be ready on the 13th of August. But if you want to do that manually, then you can switch to a page. And if I save that now and update the app, then when the patient clicks on request an appointment, the page will appear which says we have now closed because we've reached safe capacity. It gives patients other options then. It doesn't just say, please phone back tomorrow, or please fill a form in tomorrow. It gives the patients, you can still submit nurse appointment requests, or you can still submit admin queries. You can phone NHS 111. We also advocate the sort of promotion of the common ailment service for patients as well. We put the education video in there for the common ailment service. This has been, we'll have to code this properly, but you can also put a link in for pharmacy, all the pharmacies in your area. So the patients are not just left with, please phone back tomorrow, which is what I used to do as a PM when we got full. We're full now, phone back tomorrow. I think the access guidelines now deter that, or sort of at least try and give patients the other option. So that's what we can do for you. Once you do reach an unsafe level, or your appointments are full for the day, you can manually do that, or as I said, in the next app update, that'll be time frame stamped, okay? So back to the admin queries. So admin queries can vary from anything. And let's look at the forms we do have built at the moment. So custom forms, we've got in here a plethora of forms that we've built for practices. Asthma review forms, contact us about a new sick note or fit note, travel vaccination form, acute script, book a blood test, cancel an appointment, request a private letter, tell us if you're a carer, notification of change of address. You don't have to have all of these. We can choose. You can choose which ones you want, and then you can sort of see if you wanted to book a blood test or notification of change of address at the top. You can move it up the top and rearrange the form in the page in any way you want to. When patients do select these, then the form will appear, notification of change of address, and they can fill that form out, okay, and then submit that. And again, when we are filling out a form for you, you can put a success message on there to say thank you, a message has been sent to your surgery, and you can change the form in any way. So let's take a look at this form here. Tell us if you're a carer. Then the patient can fill the form out, name, address, name, date of birth, phone number, address, and details, and submit that form. If you need a signature, again, we can put a signature on there. But we can submit or build forms for you now for any type of admin query. Okay, so if a patient wants to request a sick note, we can make that available. Sick note request, there we are. So we can additional. So this is a continuation paper, and they can fill that form out. Now, if they want a form for a new sick note, I don't know if that's on there, but we can build a form for a new sick note, and the form to self-certify is there. So let's take a look. I'm sure we do have that. New doctor sick note more than 7 days. There we are. So we can build this up. We can put that to a form status active. Where does it go? Admin queries. And again, we will discuss this later. We can assign this to a team in the workflow. So we'll put that to the reception or admin team that will go directly then to that team for them to process that application. So let's add that into the app and update. Let's take a look what this form looks like. Admin queries. There we are. Not new doctor sick note more than 7 days. And there we are, so that the patient can fill this form in. Now, if they haven't been ill for more than 7 days and need to self-certify, they can now do this online without having to fill the form in or download the form to self-certify. They can go to the HMRC Gov website and they can self-certify online with their employer just by going through this form here. So there's no need for them to print off or you to print off the form for them anymore. They can do this digitally through the app, which links them to the HMRC Gov website. So this is the forms that we can build. As I said, we can build any type of form for you. You don't have to use all our templates here. You can see we've got a lot of templates now we've been asked to build by Prcatices. Doctor's private letter, joint injection. We can specify, for example, in the joint injection letter form, which injections you do ankle, elbow, hip, knee, spine, shoulder, wrist. If the GP isn't doing all of those, we can delete one. But we can really make it easy now for patients to submit those forms to you digitally. So that's the admin forms. So next, now we go on to nurse appointment requests. So a lot of practice said they get inundated with requests for treatment room appointments. So to sort of alleviate that, we've built a nurse appointment request form. And again, the patient can fill this on behalf of themselves or on behalf of somebody else. You can choose to do that or not. You can put instructions in there, name, date of birth, and then we can list for you all of the appointments that you do offer under the treatment room banner, whether that's be with a nurse, healthcare support worker, phlebotomist, or any other discipline really that you may have in primary care. And they can specify morning, afternoon, anytime. But that really will help to reduce the phone calls coming in, so the patient can make a request then for an appointment in treatment room. Again, you can choose to have that or not, okay? And the name request an appointment, you can change that to whatever you want. You can request a triage appointment, request an urgent appointment, request a non-urgent appointment. So when the patient does fill it in and they fill the form, they can specify, is this urgent, is it non-urgent? I suspect all patients would then fill in, yes, it is urgent, but we can build the form whichever way you want it to be built, okay? Next is the order repeat medication. So whichever platform you're with, whether it is EMIS or Vision, we can code into the portal where the button should go to. So if we scroll down to meds, we would put in here, we've got My Health Online, IMPS. If you're with EMIS, we would put EMIS in. If you do allow patients to email you, we can put an email address in. And then if you do allow patients to phone you, then you can put a phone number in. You can also put instructions there. So we've got here, please allow 3 working days for us to process your prescription. If you want to put extra in then to allow patients to remind them to allow time for pharmacy to also process, you can edit this, or we can edit it for you, okay? So, but when the patients do click on order repeat prescriptions, then the message is here. And it's also got a link for new patients if you want to fill out the GMS1 form. I need to register first of all. So this is the GMS1 form. We've duplicated GMS1 exactly as it is, so they can fill the form in, and then also they can sign. They can fill out the digital signature. When they click on your signature, there's a space here to put in the digital signature, your signature, and that will be put on the GMS1 form. But to go back to My Health Online, it has full instructions here, and it has the message you've put, please allow 3 working days. If they already have an account, they can simply click on order repeat medication, and it will open up the login page to either IMPS or EMIS for My Health Online. If they don't already have an account with My Health Online, they can click on order repeats, and then if they're already a patient, they can request access to My Health Online, But by the way, so this is new. This is a new update. So they can register just a basic account for My Health Online, which will allow them to book appointments if you allow it, or order repeat medication. They can also request access to detailed medical coded records. Now, I know some practices in Wales do not offer this. So if you don't offer that, we simply go into My Health Online, where it says, and we can do this for you. If you don't want to offer patients access to detailed coded medical records, we can just put on My Health Online and not select so you can choose which option you want now. So if it's just My Health Online, we'll save that now and go back to the app. And when it updates, again, we'll click on order repeats. And if they want to register, when they click on I'm already registered as a patient, I just want My Health Online, then the option to access detailed coded medical records will not appear, and they can just request access to My Health Online and upload all their documentation, their passport, proof of ID, and a short video verification. So that's what we can also do for you now. We can also give you that option to give patients access to detailed coded medical records or not. Okay, ignore EMIS and Vision because that's for England only for IM1 integration. Okay, so going back, and this is what it would look like if you offer an email, and again, if you wanted to offer a telephone number, then we can put the telephone number in there also. So I know a lot of clusters offer a centralized telephone number for patients to phone. Then they can order repeats, and then they can call now. And because it's a mobile or an app or a smart device, they can call that number. Okay, so that's repeats. So this is for register as a new patient or for online services. So again, if the patient needs to register, if you're a university surgery and you're using Campus Doctor, whatever it may be, you can now enable GMS1 registration in the app for new patients as well. So they can so this is the name of this, you're selecting the surgery. I need to register with a GP practice first. So they can do that. They can complete this form. As I said, it's exactly as a GMS1 form appears if they were filling out in person. And as I said, they can put their signature there. Now, once they've completed this, that will automatically take them on to the My Health Online registration as well. So they have to fill out the GMS1 and My Health Online to get them signed up to the service for you, so you don't have to chase patients then to get access to My Health Online. And when the application does come through, you will get notified. Again, you can specify where that application comes. If you want them to come to an inquiries at email address or an admin at email address in the surgery, then we can put that in there. If you don't want that to happen, you want it to go to a specific person, we can also, or a group of specific people, like a manager or assistant manager or somebody responsible for that. We can put all those email addresses in there for you, and it'll go to those specific people. When the form does come through, those people will get a notification. And like I said, when registration comes through, we've got some test registrations here. The GMS1 form will come through, and this is how it looks, exactly as if a patient were filling out in practice. The GMS1 form is here with a digital signature, and you can submit that then to NWSSP. The My Health Online registration form also comes through. This is a Vision form, and it's filled out, and it does nominate a pharmacy as well. So that's there. And the proof of ID, we've just got some random photos here. Proof of ID comes through, proof of address, and the video verification. So that will all come through. You can download the file, and once you process it, you can delete the file. Just a word of caution again, after 7 working days from the patient submitting this file, we will delete and destroy this file off our server for you, just in case you forget to do that. Okay. So moving on. So that's GMS1 and My Health Online registration. The Common Ailment service, and don't forget, if you want to move the homepage around, you can do that. So let's do that now. So let's say a practice wants to put, excuse me, the Common Ailment service at the top of the app. That's fine. All we need to do for you is to drag and drop to the top of the app under Newsflash, and then click on Save, update the app, And now there it is. So the common ailment service is there. These patient information pages, we can build, again, we can build these for you, or you can build them yourselves. Again, this Welsh blood service, it just tells patients how to book blood. I don't know if you know this now, patients can now book to donate blood online, how to give blood. It'll take them to the Welsh blood service booking service. They can put their postcode in. And then there's a postcode lookup, and now patients can book an appointment online. There we are. Click there, and they can book online to donate blood. So let's go back to the common ailment service. This is just really an education piece for patients to try and promote the service to them a little bit more. We put videos in the app as much as possible, because our app analytics, we've got the full analytics suite here, tells us that patients click on videos about 4 times more than they click on a written education piece. So we put videos, again, in English, bilingually. Everything's built in the app in English, appears bilingually in Welsh if the patients download the app in Welsh. It tells patients all about the common ailment service and how they can access it and what they can access it for. Excuse me. Again, there's a postcode lookup there for patients to tell them which pharmacies in their area are offering that service and how they can access it. So that's the common ailment service. Again, if you do have, so this is arrive yourself a face-to-face appointment. So if you do have Engage Health, and I think Jayex, I think NewMed are working on this now, patients can arrive themselves remotely for an appointment. So Jayex, your service provider, whether it be Engage Health or Jayex, will give you a URL which you can put on your website, but for patients to arrive themselves, and it will work exactly as if the patient were doing it in reception with a little TV screen, putting their date of birth in, and to bypass the queue in reception. I don't know how well it would work on a website, because patients wouldn't visit the website, but they would in an app. They can open up their app, and again, if you wanted to move that to the top of the app, you can do that. And if you have multiple locations, we can add as many locations as you want. Your service provider will give you a URL to put in your website or the app. Provide that URL to us, and we can put that in there. We can add as many locations as you have. If you have 6 or 7 branch surgeries, it doesn't matter. And then when the patient does, we got your Pencoed Medical Centre in Tredegar Avenue, which we did for a surgery in Bridgend. When the patient does click on this button, they can then select which location they're arriving for, and then it will link off to your service provider. In this case, it's Engage Health, because they have Engage Touch, which is a remote check-in service, and then it would link to the service they give, and the screen here would appear, and they can put their name, their date of birth in exactly as they would with a TV screen in your reception area. Okay. Right, next, video library. So NHS Digital have produced a health and care video library, which basically is an education piece for patients on anything, really. So we can see here, we've got the allergies, we've got anything you can think of, diabetes, end of life, family and friends, gut, bowel and stomach. So if you go into diabetes, for example, there is a library then of educational videos for patients on diabetes. And these are, as I said before, in the analytics, patients tend to 4-to-1 ratio of patient clicks on videos compared to educational pieces which are readable, or PDFs really. So they can click on anything. What is diabetes? What is pre-diabetes? How to do a finger prick test. There's lots of educational videos there. Patient can click on it and they can view the video, and they're all under 3.5 minutes long. So they're really short and sharp, much like educational pieces on Instagram or Facebook or social media, which we're used now to seeing short videos, aren't we? So this is a really good video, and it does work really well on any smart device. It's built for an app. So by us linking to this through the app, that's a really good sort of a resource for patients. And again, you can choose to put this button anywhere on your homepage, but it is having a lot of clicks from patients now, and it may be a really good educational source for them. It's only currently available in English. I believe there is a Welsh translated version coming out in the near future, so that will update automatically in the app when it does translate. Okay, online health reviews. So we've been asked by some practices to build online health reviews, And don't forget, any form can be sent out to patients individually, a group of patients, or en masse as a push notification. So we've got health reviews here. We've got a couple of reviews here. We've got the asthma review. So we've been asked to build the asthma review. So this is the review that we've been asked to build. Again, you can change this to whatever your requirement is. And again, when you code this in any form, so let's look for this form. Let's look for the asthma review form. You can have it to come in to an email address or our workflow system, which we'll go through in a bit, but that can go directly back to the nursing team if you wanted to. And again, we can change the form to whatever your requirements are. Again, we've got in the health reviews, we've got the B12 review form, so you may want to send that in. So, but any kind of health reviews, so I believe in QOF now, COPD is OCWAIF, COPD is back in QUAIF. If you wanted to send that to build that form and send it to in-app users, a group of app users. So again, you can download, we've gone through this before, you can download a CSV file from your Vision or EMIS system or Informatica if you choose to use that. You can upload that form, you can tag them as COPD, and you can upload that form then. I think I've got a form, a test form we've got on our desktop. Test users, so there we are. You can update and set the tag. So any patient now who has that, there we go. We've got COPD, and we've tagged that patient as having COPD. So when you go to a notification, push notification, you can send out that COPD form then. Let's type in anything, COPD review, and you can put in anything you want. Please complete, and you can link it to the form, and you can link then to let's just say we're doing the asthma form. There we are, asthma review. So you can send that to all users, or you can send it to those patients who've been tagged with COPD, and then it'll send only to those patients. So that's really how the health reviews can help you. You can do it for medication reviews. You can build a medication review and send it out to anybody who's not had a medication review. We can really help you with that, and you can send it out to any group of patients. You can even send it to individual patients if you wanted to. So if you go into app users and say, okay, well, app users, and say, okay, well, this patient needs a medication review. We can send and notify this patient. So you can send an individual patient a notification to this individual patient. And again, we can send any type of form to this, or post on a page, or a survey, whatever you want. Really, you can send to that individual patient. And again, there's no cost, okay, for sending notifications. Text, there are a cost, but not, as I found out when I went over my quota as a PM. But for notifications, there's nothing, no cost. And again, when you go into audit trail, there's a full audit trail to tell the patient if they've opened that notification or not, or if it's been delivered to them. So again, that's the review then for the health reviews. Okay, so we go on then to, you can choose to use this or not. Request for acute prescription. So some PMs came to us and said, we get a lot of patients coming to us who want an acute script. They fill out a form on reception. Maybe sometimes they don't fill it out correctly, and we've got to go back to them, or it goes into the paper trail or the to-do tray in the back office, and sometimes gets lost. If that is the case, you can now allow patients to request an acute script online through the app. They can fill the form out. Again, we can build the form, structure the way you want it to be filled. And if they do have a discharge medication from a hospital, they can upload that file. You can choose to have this or not. Some practices find it very useful. It may be useful for patients who are maybe housebound and can't come down to fill out a form, and then the receptionist has to take the request over the phone. For those type of situations, patients can then request that acute script digitally through the app. Again, travel vaccinations, we can build a travel vaccination request form, and again, that can go back directly to a team, maybe go back to the nursing team or the admin team, whatever it may be. And we've also got a link to Fit for Travel. So if patients need to find out what medication, what vaccinations they do need, they can take a look at this. But they can fill the form out exactly as any other form. And then, if you don't offer Japanese encephalitis, if you're not a yellow fever centre, we can sort of take that out of the form for you. We can build it to whatever specification you want, and then the patient can submit that. Let's go back to what else is in the app. So that's travel vaccinations, book an appointment. So if you want to start allowing patients to book appointments through My Health Online, we can again link to that. If they don't have an account, they can register. If they do already have an account, they can you can link them directly then to My Health Online, and you can go into Vision Appointment System, right click and make available for online. Maybe for flu clinics, they can book those clinics online. If you're not allowing that, again, don't worry. We can just go back into the portal and the button for book appointments online. Then we can simply untick that, and that's been taken out for you. What else is there? Cancel an appointment. So a lot of patient surgeries were reporting that they have very high DNA rates. So we can build a form to allow patients to cancel an appointment. You can put instructions in there to say if it's within 24 hours, they must phone you, or within 12 hours, whatever it may be. But again, the patient can click on appointment, click to say doctor's appointment, nurse appointment. They can specify the time. They can say who it was with, and then submit that, and then that can cancel an appointment. Again, you don't have to use all of these. You can choose to use it or not. Book a blood test. So a lot of health boards now are allowing patients to book blood tests online. In this case, it's Swansea Bay Health Board, and they can book a blood test. And for this particular surgery, they have they're under 2 health boards, and they have multiple sites where the patient can book. So Swansea Bay, Llanelli, Carmarthen, or Ammanford. So when they do click on this link, it's got the instructions from the health board, and they click on the location they want, and it'll take the patient to the Hywel phlebotomy service Llanelli online booking, and they can book into slot 1, slot 2, slot 3. They can choose then a date available for them. There's nothing available here at the moment, so let's go to the next month. Maybe it's full, and they can choose then a slot 26th of August, 9:45. And they can fill the required form in then. If your health board does allow this, then we can build a landing page for you, which will link to multiple sites. Or if you only have one site, then there's no need for this landing page. We can then just book. We can just link then to the online form, and the patients can book in to that form for that site then. And they can fill the form, and it'll go, there we are, book a blood test. So it can follow any type of pathway, okay? So that's the book a blood test. Next is self-referral hub. Now, if you do allow patients to self-refer to stop smoking, to maybe the nurse, or physiotherapy, podiatry, we can build a landing page which links to all these self-referral pathways. So for this practice, they've got some self-referral pathways here. This is Madryn House, and Dominique has very kindly allowed us to share this. So they've got a self-referral to physiotherapy pathway. They've got a Families First self-referral form. They've got an LIFT or LIFT referral form. So again, we can build a landing page which links to all of your self-referral forms, and patient click on it. You can link them directly to the form, or you can link them to the information that the health board would like them to read first of all, and then they can fill out the form on the self-referral pathway there. To make sure that it is maybe relevant to them. If you want us to put instructions here for patients on how to fill the form out, like we did with the book a blood test, we've got instructions for patients here on what they need to do, then again, we can do that for you. Just let us know. But it's really easy. It's really important, really, for self-referral, so patients can access it. Usually, they have to fill out a form, or download a form on a PDF format, fill it out, rescan it in, then email it off. It's much easier for patients to fill out the form digitally, and they're far more likely then to self-refer. Right, mental health and wellbeing. Now, this is really important again, because NHS 111, with their stats, tell us that 16% of GP consultations relate to mental health. So we build a mental health hub relevant to your health board. Everything is available on the health board's website, and that you've told us through maybe social prescribing or care navigation, we can put into the health hub. Now, here is an example that we did for a health board, where there's lots of videos there. They've got Silver Cloud, and it's got the self-referral pathway for Silver Cloud. But you may have some localized pathways there. You may have a crisis team, so we can link to the crisis team. Whatever is available within your health board, or locally, actually, if you have a mind counsellor coming into practice, like I used to when I was PM, you can tell patients all about that service and how they can self-refer to that service. without necessarily needing to take up that GP time, because the GP may just refer to that service anyway. So this is really an information piece and an education piece again, much the same as the common ailment service when it was an education piece. The mental health and wellbeing again is an education piece for patients who can self-refer. Helpful conditions, again, this has been in the app for a long time now. We are an NHS syndicate partner with NHS Digital, so anything that they produce is in here. It replaces Google basically for patients to find what they're looking for. They can scroll to find what they're looking for, or they can search. So if I'm looking for stop smoking, I can type in smoking, and anything relevant then, which in the app which has smoking as a keyword, will bring that resource up. And again, we do localize this for Wales. So again, we have Help Me Quit in Wales, don't we? So patients can self-refer through the app, or they can ask that service to get in touch with them. And this updates automatically without us or you having to do it through an API. So what else is in the app? We've got the NHS COVID Pass, and this is still relevant for patients they need a COVID pass to travel abroad. So if they need to get access to the COVID pass quickly, they can click on that and they can get access to NHS Digital. Unfortunately, this is not available in Welsh yet. I think it is on the cards, but they can get their COVID pass. Now, some patients are exempt from the vaccination testing. So those patients are severe allergies to all available vaccines, previous adverse reaction to a vaccine, or learning disabilities, autism, or a combination of impairments. For those patients, they can't get a COVID pass, they can't go through testing, and they can't have a vaccine. So this is an exemption certificate. They can fill it out, and it'll go directly back to your health board, and the patient fills it out, and the health board will issue the exemption certificate directly to the patient without you guys in practice having to do it, okay? And again, this page does tell patients, do not contact your GP surgery, as your surgery cannot help. All the information is here for patients, and through our API, it updates all the latest information from Welsh Government also. So it is a good idea to still have that there. And when booster vaccinations do come around, when you get your information about that, again, we've got a link in the app's homepage to book a COVID-19 booster. So if you want to enable that, we can tell patients, we can build an information page to say, we're doing it in practice. You can book, this is how you book, or it's being done with the health board, again, in mass vaccination centres. And it'll tell patients how to book. If there's an online booking system, we can link to that booking system. You can tell patients all about that. You can build its own button, or we can put it all under the COVID pass, or again, we can put it under the COVID-19 vaccination hub. Okay, we've got a hub which will combine the testing, COVID pass, information about boosters, a booking link. We could put it all under one hub. There we are. So the COVID-19 information hub. So again, it'll go to that information hub you want. Okay, check your symptoms. So I know a lot of surgeries are using maybe AccuRx. We'll put the link back in, okay, for AccuRx on online triage. There we are. We'll make that available. So let's make that available in the app now for AccuRx. But we're just going to point out a quick problem. So if you are using AccuRx or Ask My GP or any online triage provider, then when the patient clicks on it, it'll take them through to your AccuRx page, and we've got an example here. So admin query or medical issue, exactly the same as we do really. There's a form for a patient to fill out, again, which we've duplicated for free for you in the app. But let's go back to the home page for AccuRx, and they've got I want to see online advice. Now, for practices in Wales, the patient click on this, but it will take them to the NHS England page, and all the information there is for England only. So if patients want to self-refer if they click on the A to Z of health, for example, and they want to find information here, it'll give them English only information, and it'll give them how to access that service, but it'll give them an access. It'll ask them for a postcode, and it'll only give them services available in England. So it won't give them the Welsh equivalent. So for that reason, we've put into the app the Check Your Symptoms, or the Symptom Checker for Wales, which it'll update now. So this is the NHS Wales 111 Symptom Checker, which is available in English, and it has Recite, which has the accessibility on there. So they can search for anything here, but it's Welsh specific. So maybe ask your service provider to link to this and not the English system, because it's not bilingual for a start, and it transfers patients to, or recommends services in the community for patients which are in England only. So that's a really good idea to have that Welsh specific pathway in there for Welsh practices. So what else is in there? Community and voluntary services. So again, patients don't need a prescription for everything. So when you are working in your clusters and you do have care navigators, or you're working with a third sector, please do send that information to us, because we do put a lot of information in there for you. So let's look at a very good example. I'm sure Central Vale will not mind me showing the good work they've done. Let's go to West Key Medical Centre, where they are part of Central Vale, and they've got a really good section here on community and voluntary services. So this is their app. And let's scroll down to here where we've got that information there, and look at what they've got. So they've got Jayex as a default. So Jayex, it'll show patients in there, all the services available for adult services. If you click on adult services now, being well, being social, being at home, being safe. But also they've got on there a lot more than that. So they've got stuff like Age Connects, Families First, Wellbeing services, in-work support, East Wales platform, Cardiff Vale Wellbeing service. So all this information is really good for patients to find information that maybe they don't need a prescription or a GP consultation or a consultation with somebody. They can just find that information, and they can click on it, Families First, and they can call or email. All the information is there for them. So please do remember, we have a fully managed service. Send this information to us. The more information in the app, the better for patients, the better the patient experience, and the more service they can offer. And maybe then they don't need to get that GP consultation just to find out what's available in your community. So that's the button on, let's go back now to our test surgery. So that's the button on community and voluntary services. So that's the overview of all the buttons you've got available in the app. Now, again, like I said, you don't need to use all of these. We can switch them on or switch them off. We've got other things then. We've got your surgery, we've got updates now. So call now, email, opening times. We may want to put your front door opening times or your closing time, about us, your branch surgery details, your practice teams, out of hours links, what's on in the surgery, walking groups, Age Connect, Age UK. If you've got flu clinics coming up, let us know. We can advertise those. Okay, so that's the overview of what we've done in the app for you. So please do let us know if you want to enable or disable any of those features. Okay. Let's go on to the next part. So app analytics. So it's really important that we have full app analytics. We've got a new suite now of analytics. When you click on here, on app analytics in the portal, so you've got a date range. You can look up exactly what you want in a date range, and you can search for anything really. So say you put a page out, then you want to know what's going on. So let's type in flu. We have a plethora now of stuff coming up. But you can see, what's on clinic. We've got that. You can see how many clicks it's had in total. But more than that, now we've got the Firebase analytics, which is, I don't know if you're aware, but Google Analytics will be closing down soon. It'll be going to G4. That's a new analytics suite for Google Analytics. We're moving to that already for you. So obviously this is our test surgery, so it won't be very, very active data, but we can put Firebase Analytics into all of your apps now. And it'll tell patients how long patients are spending on the app, how many pages they're looking at, what's the first page they do come into, are they being referred to organically, or are they clicking on links on your website? What's the sources are coming in from Google? Is it coming in from your website? What's the first page they're looking at? How long are they looking at? And what's the second page? What is the journey? And when we do look at workflow later on, we've got full analytics now around. So I believe you have a new QI project now to say how many form submissions have you had through an app or through your website. We can tell you now how many form submissions you had. and you can do a date range for that. So how many forms for sick note requests have you had? How many forms submitted for an appointment? You can really break all that down now and produce a report for that. So when you do have QI data of the QI project coming in and you need that data, you can look at this, okay? And then you can, like I said before, how many times has patient clicked on the common ailment service? How many clicks has it had compared to a PDF form? You can really narrow that down now and find analytics for everything that a patient can do in the app. And we'll also link this to the website when websites come live for us, moving away from Google Analytics because that's a bit dated now, and going to the G Cloud Analytics, which is a new version of on the Firebase. We'll put that in for you. So when we do update the app for you, we have a section for Firebase Analytics. We'll apply that to everybody. Okay, what's next? We've got notifications. So we can send notifications to anybody. And if you just want to send out, and by the way, if you are doing an access survey now, I believe we have it in the app now. We built the form and we sent out a template for you. You can send a notification out to patients, send notification with that NHS GP experience form. And we've got a template here, so patient survey, and we can link to the survey. And you can send it out to all users and send to all users. That'll go out. And if I update the app now, that's come through on my phone, on my, there we are, there's a notification there. I don't know if you can see it. It'll come through on the phone. There we are, that's the notification come through. It's come through also on my Apple Watch. And if I refresh the app, here it is, then the patient's there. Example, we've done the Conwy East cluster. I don't think this is open, is it, at the moment? No, this form is not currently open. I think it opens on the 1st of August. But it can link to that form for you, okay? But we also, and when you go to analytics, it'll tell you, right, it's been sent, patient survey, and it's been sent to our 3 test devices. Also, obviously, if you have more, you will have more patients who've got the app. It'll tell you how many patients have been sent to. But we can also now send scheduled notifications. So let's just say I want to send a scheduled notification. Let's just see what you want to do the patient survey. You want to open the form on the 1st of August. Fine. Let's link to the practice survey. Send to all users, but don't send immediately. Send a scheduled date and time. So let's say I want to send this out on the 1st of August at 9 a.m. There we are. I'm going to send that to all users. That's done. So that's scheduled now. So if you go into your audit trail, we can see at the moment it's scheduled to go out on the 1st of August 22 at 9 a.m. and it's going to go, at the moment it's been sent to 0 devices because it's been sent to nobody, but it's scheduled. So that's fine. That'll sit there and that will automatically send to all your patients on that date when that form becomes available. It's not only for a form. You can schedule a push notification for anything really. If you're telling patients you're closed on a certain date, you can schedule that, and you can put multiple schedules in. So if you want to send it on the Tuesday before you've closed for staff training on a Wednesday, you can send that out there. If something changes and you don't now want to send it out, just simply click delete. And that scheduled notification will no longer be sent. So that's that. So we were asked to do that by practice managers. We've done that for you. And when the notification has been sent, again, you can go into audit trail and you can see that being sent out. And don't forget, you can send to individual patients. You can send to groups of patients. Again, we can help you do that by building lists from Informatica, Vision, email system one when it comes in, anything really from your clinical system. Okay, we're almost done. But next we do go on to workflow management system. So this is really for practices who do not use a triage service. If you want to allow patients to submit forms to you by email, you can do that. You can say send all by email, and then when we build the forms, we can put the forms in and we can specify an email address for that form will come into. Either it can be either admin, inquiry, whatever email address you want the form to come in. So that's requests for appointment, clinical requests, nurse treatment room requests, admin request, whatever it may be, they've been sent to you by email. But some practice managers didn't like the thought of them coming into an email address because there's no audit trail there. They can be lost. You don't know who's dealing with it. So we were asked to build similar to what AccuRx or your Ask My GP eConsult, what your service provider has, and we've done it for free for you. So you can go into your portal and then you can say, we can want all forms to be managed now in the portal, so that you can save that. So we've got the forms and workflow management system here. So I'm going to give you a brief demonstration now of how that looks. So you can add now staff teams. So you've got teams of staff. You can build a team. So for example, now on this, I've built examples here of a GP team, nursing team, or you can edit that. Let's put in treatment room team or whatever you want. But if you want to add a new team, just simply add a new team. Let's put in, I don't know, nurse prac team. There we are. Right. So that team has simply been added, and that's as simple as it is. You can add the team there. Okay. So you've got those teams. Now, if you want to put add staff, add a staff member. So you can give staff access to this portal here. So if you want to add a new member of staff, again, just add their first name, last name, start access level. Now, if you're a manager, this will give you access to all of this. But maybe receptionists or admin teams, they don't need to send notifications to see app users or app analytics. They don't need to put news events out. So if you just want them to have access to staff, they will only have access to workflow system, which will also give them access to notifications to individual patients, which we'll show in a bit. So if you're building if you just want to put a receptionist or admin team or a GP member, and they don't need access to sort of change the app's content, just workflow, just put in staff, their job title, and then a team. You can specify that staff member be a member of a staff team. Put their email address and then save, and then that will send the registration token to that staff member to activate their email address, choose a password, and then they will be given access to this portal. Now, when they're given access as a staff member, let's just change me. So let's see what they will see. So let's come into here and give me a view as a staff member, not a practice manager. So I'm going to put myself as practice staff. I'm going to log in now as a practice staff member, just to see that they can't change, staff members cannot change the content of the app. Only managers can do that, and we give you access as a manager. So when a staff member logs in, there we are. They can put a news event out, they can access workflow, they can access registrations for new patients to register, for My Health Online registrations, and they can access the workflow management system. And they can also access support from us. So if they want help from me or any of the team here, we have 2 staff members now who update the app and act as support, they can do that. So staff members cannot change what's in the app at all. That's restricted access to managers only. So let's go back now and make myself so let's just say I'm a manager. Let's do this very quickly. Okay, so let's log back in to show you workflow system. Sorry, just catching up. Okay, so we're in workflow, and we've built the staff team, we've built the staff members. Now, when custom forms comes through, I showed before, we want to allocate these forms so they automatically come in to staff teams. So nurse appointment, let's just say, okay, well, I want all requests for nurse appointment to come to the admin team then. So save. When the patient submits that form, it will automatically go to the workflow management system for the admin team, and they can specify then where they want that to go. You can do that with any custom forms. So let's just we built an asthma form earlier on. So let's just say the asthma form, I want that to go directly back to the nursing team or the nurse prac team, wherever it may be. You can specify where that form goes. And when it does go, so when the patient does complete the form, again, with the custom form builder, you can specify that you want us to, you can specify a message to say, for example, this message in here, we've got, thank you for contacting the practice, please ensure you always have a phone access. So when a patient submits that form, that will pop up in the app for them, or pop up on the website to sort of temper their expectations, really. If it's non-urgent, it takes 5 days. You can put whatever you want. But when the form is submitted, they can click on workflow management, and this is where we've got an audit trail for you here. So we can see now that I've submitted as a patient a test form, and I've submitted a request for an appointment. So we've got one there. We've got one form waiting. If you want to see everything that's been completed, you can click on include completed forms, and then it'll include everything that's been completed down here, and you can specify, then you can look for a patient. So let's click on Steph. Everything I've completed here, you can view it, and you can view everything that was done with that form. I'll go into audit trail in a bit now. But let's go back to workflow management system and just say, okay, this is a new form. You can see it's come in the date, the form type, the patient. So this is me as a test patient. Who it's been allocated to. It's been allocated a reception team, and it's a new form. And you can see here that there's one form waiting to be processed. So let's click on that form and see it. So we can see all form submissions, and whenever so if it's contact us about new, that would be the title. If a patient submits a form for a new or ongoing sick note, that would be there. I'll do that in a bit just to show you. But if we view the form, we can see the form here. We've got the user details, and if they have any tags, like they've got this patient has COPD or they're eligible for flu over 50, you can see that in that form. So you can see here that now the form has been completed. You can download the form as a PDF if you want to. You can view the photograph the patient submitted quite easily. And you can see the form, or you can copy the clipboard. And copy the clipboard means you can copy that over very quickly to your clinical system. Instead of having to download the PDF and then save it and submit, you can copy, and this will copy everything into the patient notes. We are working with EMIS and Vision to code these back directly, so you haven't got a copy, it'll just be coded back with the PDS with the patient demographics. But we'll advise you when that becomes available, and also when IM1 is switched on in Wales. But now you can see this, so you can do anything you want with this now. Status is new. If you want to do something, you can just say, okay, well, I've appointment allocated, maybe. You can say as complete. I won't do that now, I'll just do in progress. Or you can assign it to somebody else. So I'll assign it to, let's assign it to myself. There we are, so save. I can say, please arrange appointment. So if I'm arranging an appointment, and thank God spell check is built in, I can save that now, right? So once I've saved that, you can see that that's been saved completely in the audit trail. So if anybody goes off sick, or if anybody goes on annual leave or anything, you can see you can look and see what's going on with the request from a patient. And if I go back to my workflow system now, I can see that that's been assigned to me as a task. So I can go into my task and I can see that view. This person has put in there, oh, okay, please arrange appointment. It can be whatever it is. And if I see, well, I want to view that photo. There we are. So we've got the photo. The patient would submit a photograph with the skin lesion, whatever it may be. You can see that photograph very quickly. So you can do whatever you want, really, and they can say, okay, well, I've done the I've booked an appointment, booked app, complete, done. Or you can reallocate it to somebody else. But if it's complete, save. And if I go back to workflow management system now, you can see the 0 tasks there, and that form has disappeared. But if for example, a patient makes a complaint, or you want to know what's going on, you can just go into include completed forms. All completed forms will be there. You can search for the user, and then it'll bring the form up. There we are, and contact us, and you can view it. And again, you can go in and see the full audit trail, the date and time, and who did what. So you can choose to use that. And like I said before, if you want to see, if you've got lots of forms coming in from patients, we've made it easier. And so you can have a list down here, and it'll tell you the form. Or we've got the tiles view as well to see request for appointment. Tell us if you're a carer. And in the next update, on I believe it's the 13th of August, it'll say total forms, how many are new and how many are in progress. So you can actually track then what's going on. In addition to workflow, you saw app analytics here earlier on. We're going to build workflow app analytics also to make it easier for you to print off or to generate a report, really. So if you wanted to see, okay, in the last 4 months, please tell me how many form submissions we've had for tell us if you're a carer. Click report. So it'll tell you exactly how many forms have been submitted in the last 3 months, the last 12 months for tell us if you're a carer. If you just want a report on entire forms submitted, you can in the last 12 months, you can. But you'll also be able to ask the report to narrow down or specify what types of reports they are, because tell us you're a carer may take 5 minutes to process, whereas acute prescription request or B12 review form or request a private letter from a doctor may take 8 or 10 minutes. You can then say, okay, well, that letter takes 10 minutes. We had 24 requests for private letters. 24 times 8 means it took us this amount of time. But you can do that in the reporting software. That will come in on the 13th of August for you, just again to help with that QA data, or QI data, really. Sorry. So I think that's workflow management system covered. You can have your very own inbox, really, and I think this is a bit safer for practices as opposed to an inbox, because you do have that full audit trail there, and practices who are already using it or helped us to build this said that it really does help when staff are maybe busy, or they're on annual leave, or they've gone off sick. You can go in and really see, okay, well, what's happening with this? Okay, we're waiting for this from the patient. And don't forget, if you want, say you've had a sick note request and you've processed. Let's take a look at that. Let's take a look for one of those. Complete, and let's search for a request for additional sick note fit note. So let's view this. The patient's requested it. There, fine. Okay, you can view the user, or you can notify that user directly to say, there we are, new user, and you can build any templates you want. So you can use them very, very quickly. But you can type in form ready, and you can type in whatever you want. Blah blah blah. Send to user. So that's going to send now to that particular user. And again, if you go into the audit tray, it'll save that audit. It'll say sent notification there. And from the notifications, you can build any templates you want to do. Notification templates. Add new template. You can say sick note ready to collect. You can put in whatever you want. Save. So when you do want to send that that notification to the patient, it's very easy. Let's go to include completed again. View. Let's view this. Notify user. There we are. Sick note ready. Collect. Use. And then send. You can send anything you want, really. You can send care navigation to the patient. You can send a request for more information to the patient. You can request anything from the patient by using that workflow system, really. So that's available for all practice now. I hope you've enjoyed this video. If you do have any questions or queries, or if you want more developments in the app, please do let us know. We've got a few developments coming out again in August. We will let you know about that. The websites are coming out in August, and as I said, it's a fully managed service, and we are using the Enhanced Translation Tool API developed by Bangor, so that anything in the app or on your website, and we're using this for free, will be translated properly and accurately on your websites with the Welsh translation. Obviously, we'll have Google Translate for every other language, but specifically for Welsh, we're using the Bangor one and Bangor API, so that will automatically translate everything in all your Welsh text, paragraph by paragraph, not word for word. We also have the practice leaflets coming out, digital practice leaflet linked to the website, so we will manage all of that content for you. As I said, we've got free QR codes we can create for you with free hosting. We've got graphic design coming out now. We've got patient education videos where we can do the recording for you in a professional studio or on site, or produce animation videos for you bilingually. And we've got all the graphic design now, so you need logos or posters or patient information leaflets designed and printed, and we can do all of this for you in-house. So please do get in touch if you want any of your app updated, if you want more information on the website, on the workflow, anything like that, please do get in touch. And thank you for watching. Diolch yn fawr.